Welcome to the program. My name is Vince Nigro. On Insights, Yara Attalla. She is a facial Botox cosmetic expert. She talks to you about Botox, fillers, what you should and shouldn't do, what you should be looking for. She talks about the latest trends. Yara on Insights. Yara, welcome to the program.
Thank you for having me.
Yeah. You are a nurse,
Yes, I am.
and you started out. Would you get your nursing degree here in Canada? Was it here in
Yeah.
Canada you became a nurse?
Yeah.
And what made you decide to go into nursing?
It was definitely a surprise. It's not what I initially wanted to do. It was never on my radar. But then I started out in neuroscience and my mom got ill. And after she got better, I started going with her to her Botox and filler treatments. And it was the first time for me and my mom to experience any of that stuff. And I loved it. I loved it so much. I loved the way that it made my mom feel. And
It
ever since
got your
then,
curiosity going when that was happening.
it did. And so I switched to nursing and I knew exactly what I wanted to
Right.
do.
So you have a nursing background,
Mhm.
and that particular situation got you thinking about combining your nursing background and education, and you got into what they call the cosmetic, revitalization, looking good, getting the edge, whatever you want to add to it. And it's like you said, it's as whether you're young, old, or whatever, it's always feeling good. It's finding the edge. And I guess if you feel good, maybe externally you feel good internally.
Absolutely.
Um, so you are a cosmetic uh,
I would say cosmetic injector.
injector,
There you go.
and I know that you're on social media quite a bit, and you're everywhere, and you've experimented with different things. Um, and the word you always hear, Botox, fillers, injectors, whatever, and mainly you think of it with your face, and it associates with lips and cheeks and forehead, and all kinds of sagging stuff. And we're going to get into some of the other areas of the body that it's worked for. Um, if Tell us a little bit about what really Botox is and fillers, what and the difference if there's a difference between Botox and fillers. Give us a little bit of
Mm.
context in terms of what Botox is.
The way I like to explain it to someone who's, never doesn't know anything about Botox and filler and kind of assumes they're the same thing is Botox is it relaxes muscles. Okay. So it has to do with movement. So if a wrinkle is happening due to a movement, then that movement could be suppressed. Okay. So that's how Botox is. And Botox does a lot of other things as well that we'll talk about in a bit. But, and then filler, you can think of as a substance that augments, right? Or contours, fills in lines, right? Botox doesn't do that. It's mainly the fillers or the dermal fillers that do that.
And I know there's a lot of products associated with skincare and moisturizers and creams, and you see the fads coming and going. But just staying with the Botox and the fillers, um, there are a lot of botched up situations that people had that, they may go to someone that thinks they're an expert, but they're really not.
Hmm.
And a lot of folks, before they even consider doing it, should really do some research on it and make sure who they're going to see is a registered person. And you have to have a nursing background to at least do the injectable. Is that correct?
Yes, you have to have a nursing background at least in order to do it, but lots of experience. I think that's very, very important. And keeping up with your training because there's always new things coming up, right? You can't be stuck in doing the same technique, they used to use 10 years ago. So you're always keeping up with your training. That's what's really important.
So as you started to combine your nursing and the whole cosmetic industry, you started working on some people. You mentioned in the past that you started in your mother's basement. So you started to experiment with that, and obviously that business evolved because your success got bigger and bigger, and you diversified in it. With regards to products, as I said, you hear about Botox and fillers. I know that you've experimented with all kinds of different situations with salmon, sperm
Yeah.
injections. A lot of talk now is with the PRP type of situation where they take the blood and they spin it and they re-inject it. Can you talk a little bit about some of the newer trends that are happening right now and your trend with the fish sperm?
Mhm. I feel like now we're kind of moving towards an era where everything is undetectable and people want to focus on trying not to age as fast, as let's say their mom or their
Right.
grandma or whatever. So they're trying to do a lot of preventative work, and that's where stem cells, PRP, and salmon DNA come in. They help you prevent the decrease of collagen in your skin. They help you retain some of the elasticity that maybe you've lost. And so a lot of people are looking at those preventative things and starting earlier so that they don't have to get a facelift maybe at some point. You know what I mean? So a lot of
Sounds like the
people are.
preventative do some preventative care and
Mhm.
preventative work on whether it's your skin or certain parts of your body. So longer term, it gives you more of that fresher, younger
Yeah.
look.
Yeah, and almost like an advantage, you don't really need to do as much corrective work when you've done all of those things to maintain and make sure your skin is still supple at a certain age.
Are there any side effects with Botox and fillers and some of the injectables that you work with? Are there generally some reactions?
I think that the biggest side effect would be, going the product being in someone's hands where it shouldn't be. You know what I mean? If you're a professional and you know what you're doing, usually those side effects are minimized to swelling and bruising. Obviously, we look at interactions as well. We look at someone's medical history and making sure that there's no interactions with anything that they're taking,
Medications and things like that.
medications, exactly. But usually it really does boil down to who is injecting. And when someone is injecting, to look out for signs of complications as you're injecting, also educating your patients
Right.
as to what to look out for. It could be bruising, could be swelling, but it could also be something else. And so looking out for those signs and making sure that there is an open communication between the practitioner and the patient is very important to kind of make sure everything's under control.
So you're when someone comes to you, whether I came to you or someone comes to you and they says, "I want to do this, this, and this," and once you do your assessment and you've got your assessment situation, there are times where you said, "You know what? I don't think you should do this. You should probably do more of this
Yeah.
because based on the physiology, based on your look, and based on what you want to do, it works better." Because at the end of the day, you also want to be to have the youthful look, but you also want it to look natural. Is that what you would look at in terms of sculpturing someone?
Yeah, absolutely. We put that patient's picture on a screen and we kind of go through it together. Okay, so this is what you like, this is what you don't like. Let's look at why this shadow is happening. Let's look at why you're getting a light highlight in this area when you're supposed to get it here. We look at every little piece of someone's face and talk about what bothers them. That's really important to me because sometimes something is not bothering my patient. Do you know what I mean?
Yeah.
And I wanna make sure that if that's not bothering you, then I don't really need to fix it. I don't really need to bring it up? So really focusing on what's bothering the person in front of me. And yeah, I mean, we do a thorough assessment of their face. We go over all of the options that they have, and we talk about everything from side effects to long-term long-term effects, right? And then people have the choice of this is how I want to go about it, the more natural route, or I want to go about it with dermal fillers and Botox. It's up to them at
Right.
the end of the
And
day.
I know that there's the argument of if you get Botox injection or filler injections, do you have to do it for the rest of your life? And I know you've had that conversation that it's not. Talk a little bit about if someone's considering getting Botox, that it could be a process for that one time, but it doesn't necessarily mean you have to do it for the rest of your life. Is that correct?
Yeah, absolutely. I always say to my clients, I'm like, you don't need to keep doing this. I mean, I do recommend to keep doing, like staying consistent when it comes to, um, preventative treatments. Consistency is key when it comes to that. But if you do Botox once, you don't have to do it again. But the reality of it is, you do fall in love with that version of yourself, the version that had the.
So is that a psychological effect
Yeah,
that happens?
yeah, yeah. A lot of times people come to the clinic after, doing Botox a few times and they're like, I was feeling like I just looked tired, or I was feeling like I couldn't really look at myself in the mirror. And I was wondering, what was going on. And it was my Botox. My Botox, it was 4 months. I was due for it. And that makes people come in
Yeah.
because you've seen yourself in a certain way and now you just can't go back. It's not that you have to get it, it's that you feel like you need to.
Right. So I always use myself as an example. If I decided to come in and get some work done on my face, which I probably do need, but if I were to come in, what would be the process? Is it a 6 month situation? Is it run me through what I would be looking forward to in terms of starting a treatment with you or with anybody that's reputable?
I would say it really depends on the person. I don't like doing everything all at once.
Right.
I like to take it step by step. So whether that's, 2, 3, 4 sessions, it really depends. It also depends on, the person's budget. It depends on
Yes.
how how long term they're looking at doing these things. Are they going to be consistent because they want preventative work, or do they want something that's just like, instant,
Instantaneous.
right? So it depends, right? So I would kind of talk to you about those things. I also, over the years, I went to a lot of seminars and I've hosted trainings alongside a lot of well known plastic surgeons. And so I try to learn from them as much as possible so that if a client or a patient is not a good candidate for the services that I would provide, like I can't help them achieve what they
Right.
want, I can give them some recommendations in terms of, okay, I think this is surgical. This wouldn't be me. This is surgical, and this is why. So yeah, we definitely go through um,
A process.
a process. Yeah.
Yeah. So most people think of it with your face, so obviously lips, cheeks, whatever. But what thing caught my attention of what you were doing as well. You talked about, and someone asked you, why do you wear high heels throughout the whole day, and how do you do it? And you had mentioned that there is also a fix for that. Talk a little bit about that in terms of it's not just on your face. It can be on your heels, it can be on your ankles, it can be other parts of your body. Talk a little bit about that.
There is a lot of ways that Botox can be used. I mean, initially, Botox was not invented to be used, for muscles, for facial muscles, but you could use them for hyperhidrosis. So that's excessive sweating under the arms. And so that's one therapeutic use of Botox. Botox is widely used in headaches and
Yeah,
migraines,
migraine.
right? Yeah. And the one that you mentioned is feet. So I don't know, some of them call it Cinderella Botox or whatever, but you do inject the foot so that it doesn't hurt when you're wearing heels anymore. So that is something. It's not quite as popular yet, but it's definitely an option.
Yeah. The process of Botox, uh, not to give me a whole scientific background,
Yeah.
but what's in Botox? Is it the combination of I know is water isn't involved in Botox, but tell us a little bit about what's in the Botox.
So it's called botulinum toxin,
Watch.
right? Botulinum toxin is the actual word for Botox.
Right.
Botox is a brand, right? There's so many other brands that are available, but I think we use the term Botox like we use the term Kleenex, right? Because it was the most popular. They came out a long time ago, but it's botulinum toxin, and what it does is wherever it's injected, especially when it comes to muscles, it just relaxes that muscle. And so when we used to work in the hospital, the one way that Botox was injected was when someone has like a stiff muscle,
Right.
right? It's injected in the arm to just release it a little bit. And you do see it like slowly over the next 2 weeks. They're just releasing that pressure that was on the muscle, for a specific time period. And then they do it again. But it has so many benefits. You know what I mean? It's used in hospitals, it's used, in aesthetics, it's used in therapeutic uses. There's so many uses for Botox. So cosmetic is just
One aspect.
one aspect of how
The
we use it.
Yeah, so the Botox piece, and I just want to talk a little bit again about the spinning, the blood
Yeah.
spinning, and some of your other formulation. Obviously, like everything else in life, you have the Ozempics on the market, you have
Yeah.
all the Manjaris, you have all these so-called quick things that are happening, and nobody still knows the long-term effects on people's systems, whether it's your pancreas or whatever. Obviously, in the skincare and the beauty area, the spinning sounds like something that is more beneficial because you're taking your own blood and you're
Mhm.
spinning it, and the whole PRP is basically taking your blood, your own system, spinning it with whatever you do, and then re-injecting it into a particular part of your body, your face. How does that compare to the Botox piece? Is it more in terms of a longer term maintenance part as opposed to a filler? What's the rationale behind the spinning part with the blood and the stem cell?
I mean, you got it right. It's so Botox again is muscles. Let's kind of
Right.
separate that. So Botox is muscles, dermal filler is made out of hyaluronic acid and it's used to augment and contour, right? So where PRP comes in, that's the more therapeutic, long-term maintenance aspect, right? So it has the growth factors. So you take the growth factors from the plasma and you re-inject it into the face. And so what that does long term is it makes sure that you're not getting crepey skin too soon. You're basically giving back to your skin what it needs, right? And so that's one of the most natural treatments that we have out there.
Would you recommend that treatment more to folks who are middle age and growing? Is that more the category, or is it open to
I
all
think I
age?
would recommend it to everybody. I think I would recommend it especially to those people who don't mind the wait. So a lot of people will go for dermal filler or Botox because they want instant results, right? They don't like to wait or be patient for results. You know what I mean? So anyone who is willing to be a little bit more patient and getting more of a natural treatment, I would recommend PRP for. I would also recommend it for people who are getting Botox and filler just for, maintenance and long-term results. But it's a process for sure. The more natural something is, I think, in my opinion, the more you really need patience to see the
Right.
results.
Generally, I mean, obviously, if someone is thinking of getting the treatment, either the PRP or the Botox, and obviously there's a cost to it, and it's like in some cases it can be more costly to others. Um, what would your recommendation be on skincare in turn, especially as you're getting older? I know the old adage, you got to moisturize your skin, wash your skin properly, that kind of stuff there, creams. Are there any do's and don'ts that you would recommend, especially regarding skincare with your face?
Yeah, absolutely. I mean, it's really great to educate yourself on the type of skin that you have, depending on the type of skin
Is
that
that
you
based on oil? How would you know the type of skin you have?
so it's based on that's a great question. I've never been asked that. So let's say you get oily and we call them the T zones. So if you're getting oily here, 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 and here,
Right.
that means you're probably combination. Okay. If you're getting oily all over your face and it happens in a matter of few hours, you're probably oily. If your skin is constantly dry, dehydrated, flaking, then you're probably dry. hmm And so you kind of have to go based on your skin type,
Right.
right? And the earlier you start taking care of your skin, the better,
Better is.
and not when you notice a wrinkle. That's when
Right.
you start. You start
Right.
early on. And I mean, if you have acneic skin, then you need to look at that. One thing, though, that I would recommend to everybody if they are a good candidate is probably retinol. Um, retinol, all the research on retinol is consistent with amazing long term results.
What is retinol?
Retin-A.
Retin
So it's actually so retinol is it's Retin-A, and usually it's prescribed by a
is a prescription.
yes.
Okay.
You can get alternatives or like
On the shelf stuff.
or on the shelf stuff that the percentage is a little bit lower, or non-medical grade. But, I mean, the way that I do it is I go to my dermatologist and I have just her prescribe me the retinol, and I've been doing it for years and years,
Right.
and it helps so much with skin tightening, with exfoliating your skin, with, just skin rejuvenation, just everything.
Yeah.
So if there's one thing, retinol.
Right on. I've had a couple of um, not things done on my face from the standpoint of injectables, but I've done the facials and I've done a couple
Yeah,
things where with the machine and brown spots. A lot of people, especially as you get older, you get these brown spots. And I remember going in there and they say, here's this particular serum. You put it on every couple weeks maybe, and it'll help with the brown spots and whatever. I tried it. I just found that the follow up wasn't there. Just getting it off the shelf and that kind of stuff. I was kind of a little resistant. So, but brown spots, you're starting to see them more and more and more. Are brown spots um, also something that, as you get older, can be avoided with the proper maintenance?
absolutely. I mean, sunspots could be, uh, due to age spots, or they could just be hyperpigmentation from the sun, or it could be an acne scar. There's so many ways that you can get those brown spots or just hyperpigmentation in general. And I mean, again, retinol is one thing
One
that
thing.
will, help your skin scar less when you do get acne or whatever. But brown spots, again, you have to understand why, or not why, but that brown spot, why did I get it? Or what is it exactly? Do you know what I mean? So that's where, I would help the client understand where it is. So is it a hyperpigmentation spot because of the sun? Is it an age spot? Is it an acne scar? And from there, we figure out the best way to
Right.
treat it. But they are
Treatable?
treatable
Yeah.
as long as you don't wait too long,
Yeah. Yeah, of course.
the longer you wait, the longer it's gonna take to heal it.
Right.
But of course, there are things that you can definitely do and add to your skincare, your daily skincare, in order to prevent, but also treat the ones that you have. But I think skincare too, I wanna mention, is very trial and error, okay? For example, you said that skin cream, right? It could work for you, but could also not work for you. And then some people also give up too soon.
So you basically got to look at your body and see what works for you
Yeah.
and stay with what works for you and not necessarily keep hitting your head against the wall if something doesn't work.
No.
Be open and flexible. Let me ask you another
Absolutely.
thing. A lot of people obviously relate nutrition and everything else to everything in your body. How important is water? Obviously, water, we're made up of a lot of water. Drinking a lot of water, I'm assuming, is also another thing that you would recommend while you're doing these treatments. Because whenever you do these injectables, whatever it is, it soaks up a lot of your water fluid. So it's important to keep hydrated, I'm assuming.
Absolutely. Especially if you're getting filler. Dermal filler is
Yeah.
made out of hyaluronic acid, and it really grabs onto those water molecules.
Dehydrates you.
Yeah. No, it grabs onto those, molecules, so it actually
Molecules.
attracts them. It actually attracts the water towards them. So if it doesn't have that, you typically will see, like, a little bit of dehydration around the areas, or, it just looks lumpy, and, so you do need to stay
Right.
very well hydrated.
And finally, and we can talk all day about this. If someone is watching and is thinking, maybe has it on their radar, thinking of maybe doing a session or two, what is the best advice you would give them? How they would
A
move
second
forward?
of 2 of just, I mean,
Consider doing the Botox. What would you best recommend?
definitely do your research. Don't go in blind. And when I say do your research, it's not, I don't mean like just about the person doing the treatment, but I mean what you're getting. There's so many resources right now. There's YouTube, there's Instagram, there's, TikTok, there's researches, there's actual research that you can look up. Know a lot before you sit in that seat and like meet the
Right.
practitioner. Okay. A lot of times clients come in and they have no idea. And sure, I'll educate them. But I say, before you say yes to the treatment, I want you to go back home, watch a bunch of YouTube videos about this treatment, and then come back. Because when you come back, I want you to be confident that this treatment is what you need.
You know, um, we can go on, and I appreciate you being on the show, but maybe next time we'll come to your location and I'll do a before and after. I'll, I'll do a before and after and maybe we'll try that out. But thanks for coming on the program
Thank
and
you.
educating us a little bit about Botox and the whole cosmetic thing. Because as you know, there's so many fakes out there and fake products out there and on the
Absolutely.
black market and stuff. So it's really important. Do your research, talk to people that have experience, talk to people that have done it. It's like they say, you want to buy a Ferrari, don't buy it without driving it. Drive the Ferrari
Test drive it.
before you test drive it before you do it. So we appreciate you being on the program, and hopefully we'll be able to one day come out and do a session with you.
Yeah. Thank you. I'll wait for you.
Okay. Thanks for being on the program.
Thank you.